Firstly, we need to honestly admit the health systems in Africa were never designed to dealing with brain health conditions. Rot. I don't care who says what. That's the reality of it. It's just human dignity that all we should be striving for. To reverse the poverty, to respect each other, to love each other more, to be there for our families, to be truly, truly human in a sense of our interconnectedness with our people. The financing aspect of health systems in the global south has always been relying on donor funding, not governments. What then tends to happen is that the donors, especially in the context of where the wealth is, there's donor fatigue. There's a need deliberately that the governments engage extensively with the churches, with the traditional leaders, so that that demand can be pushed into the facility, because of course modern science have the technical know-how to address this thing. But currently, if you're not doing that shift in demands to come to the facility, we're running a risk. We're going to have health systems, lots of resources not utilized, which is going to be waste, because I'm as an economist, I don't like seeing inefficiencies. Those things need to attack. We want us to imagine a health system that truly, truly designed to bias health, rather than wanting to create a healthcare system, which is what is currently happening. We've created a health system, but we have not really doing a good job to create things that gives health. We've got a healthcare system that is very good in treating symptoms, but not reversing disease. So can we have a health system that truly buys health? Can we have a health system that truly reverses disease, not manage symptoms? Can we have a health system that doesn't treat people like a conveyor belt, come in, come out? There's some utility because you visit us, then you're gone, then we have something. Because that's how the modern health systems are run. They're very hospital-centric, they're very expensive, they're doing horribly in reversing disease. US is a classical example. So we measure well-being. What metrics are we using well-being for? I do believe that going into the future, a hospital-centric model of healthcare might not be what we need, because best healthcare that we can offer is in the household, not in the hospital. But if it's in a household, what does that need to happen at the household level so that the things that are in the house are good enough for us to get health? That's the future of a global health system that I contend with to this day.
Cyprian Mostert, welcome to today's podcast.
Thanks, Grant, for inviting me. It's been a long time coming.
Okay.
Been talking about this for a long time. At some point I thought, is it going to come? But yeah, congratulations. I feel very honored to be invited here to share my perspective.
You're welcome. Because we had been talking about this for, I think, over three months.
3 months now? Yeah.
But anyway, we're here.
Yeah.
So to those that may not know Cyprian Mostert, here's a few notes that I have about him. He's an assistant professor of global health economics at AKU, Aga Khan University. With over 50 peer-reviewed journal publications, his research focuses on intricate economics of brain health and the impacts that it has on developing countries, especially. So that's a few notes I have about you. So who do you say you are?
Yeah, I think everything you mentioned, it's me. I'm a global brain health economist, but I've been in economics for quite some time. Work in a number of field of economics before transitioning to brain health. I was the HIV economist in South Africa for quite some time. I've advised the government there on investment case for HIV. Spent a bit of time also on banking and financial engineering, looking how money basically strengthens institutions. Before basically going to Kenya to assume my assistant professor position, I spent a bit of time at the World Bank and also doing a lot of work with United Nations and WHO, looking at investment in health systems in developing countries, considering the challenges that are there. Things that are here in high-income countries usually don't work in developing countries, and you need a technical person who understands the issues on the ground, but also have a fair appreciation of some of the things that are happening in high-income countries, and looking at programs that are there and try to optimize them in terms of what we need to do if they have to work in developing countries. I've also advised the government in Kenya for about 2 years now on tobacco economics, mainly on the taxation side of things. In Kenya, the work that I was doing with the ministry was just on mental health, looking at the investment case, the money that gets to be spent there, but also considering that there's not a lot of money in Kenya to do brain health or mental health, whatever the term you want to use. So I find myself now looking at the taxation of the country, looking how much resources they can raise for mental health. That's where I wasn't doing a lot of work on tobacco taxation because, in my view, tobacco is still another area that is significantly undertaxed in Africa, European countries, and there's a potential of raising resources by just aggressively taxing tobacco, trans fat, that type of work. It's something that I'm still very active on because I do believe that ultimately for the health systems in developing countries to move closer to what we have here in high-income countries, better funding is needed. And those commodities are sort of like low-hanging fruits in terms of taxing so that you can then invest on brain health. So that's me in a nutshell.
That's an interesting overview of what you've done and accomplished so far. It's interesting that you're coming from, said with, is HIV. So HIV, then you transitioned to, is it to the World Bank?
Yeah.
After you left South Africa, you went, or you were still in South Africa?
In fact, my academic journey, remember, I started from a medical school.
Yeah.
Like anyone passionate, wanting to be the best hematologist, my master's, and work for Roche, by the way. A lot of people don't know I was in pharmaceutical space at some point for about 2 years. My first job, in fact, after medical school, was in a pharmaceutical company, Roche Diagnostics in Randburg, where I was responsible to what we call business integration. When I moved at Roche, Roche has just acquired Stega and Ventanum, the two big cancer business that are in Europe. So they wanted them to be integrated into Africa. I was part of the team that was then given the task because I was coming from the hematology background. I think that was the first time getting exposed to the world of money and numbers. So we did a very fantastic job with the team there. We've integrated the business in South Africa, started trading on tissue diagnostics. But to me, I think the part was quite clear that I just didn't need things that are more clinical. I was appreciating the world of modeling, numbers and finance and all of that. So I think the interest for economics started there.
Yeah.
And then I moved back and did a master's in finance and investment. And I discovered banking and financial engineering. And I think I find a voice there because through that, I was able to see the world for what it is in terms of money, because finance brings things really into perspective to understand whether it's political economics, whether it's development economics, whether it's health economics, whether it's transport economics, energy economics. Money tells the whole story. So that fascinating with money and just working as in banking and financial engineering really exposed a lot. So after that, to me, it makes sense that when I had to do a PhD, I have to marry the two worlds.
Yeah.
The world that is more clinical or more on the medical side of things, and the world that I've already slowly is beginning to embrace with the work that I was doing at Roche, basically moving back to school. Then I could not get a program in Africa, to be honest with you, to do economics where I can have like this extensive banking, mathematics, modeling that I had and merge it with medicine. So it was clear that I needed to leave and go to Europe. And then I moved to Maastricht as the first university in the Netherlands. I have a very strong tie with the Netherlands family-wise. So I moved there into institutional investment. In institutional investment, what we're doing, we're studying pensions. We're looking things like health insurance. We're looking at how health systems are financed. It was an interesting time at the time because when I moved to Maastricht, the world have just experienced the 2008 financial crisis. Things were just chaotic.
Yeah.
Everyone wanted to make sense of what was happening because the banks have basically destroyed global economy at the time. And then the pension funds and health insurance space didn't have a lot of money. There was a lot of panic.
Yeah.
So at the time then in the Netherlands, they were looking for people who understand medicine, but also had a firm grip into finance, how things are working, how to optimize models so that we can stabilize the health insurance space. Then I was given an opportunity to join Maastricht University as an institutional investor scholar, but just also linking with the industry because everyone wanted to do something to stabilize the finances. Then from there, my life was never the same. From that experience, completed my institutional investment where I can here in Europe to stabilize the health insurance space so that insurance was not defaulting. People can be able to access the services. From there, then I never looked back. I then wanted to do a PhD. Started at 20, looking at what can be done in the global north with the limited resources that they have. That health system can be strengthened so that the emergency or the critical conditions can be financed optimally. That was my PhD, how it started. Basically borrowing from everything that I know in banking and financial engineering and econometrics, my experience in the Netherlands and what I've seen in South Africa, studying hematology and my experience at Roche. So I was like, I wanted just to load everything in one PhD project. It was very interesting. But I had a lot of support. A lot of people came to the space. It was quite clear that the project that I wanted to do was too big. And it needed a lot of economists who were coming with different expertise. Through that PhD experience, initiating it at 20, they linked me to the Barcelona Graduate School of Economics in Spain. And then I had to start working now with Judith Val Castello, who's been my mentor. We did fantastic work, exposed me to policy engineering, things that I've never known, and the mathematics that comes with it. So that has been the journey. And through that, I got then appointed or scouted by the World Bank as one of the emerging economists who can come and assist to make sense of health economics, because at the time there was a guy called Adam Wagstaff who's been a brilliant health economics. Everyone knows him. I was then recruited to come to basically work into the department and looking at social health insurance, which was the big thing at the time. I think WHO was led by Margaret Chan, and they were advocating for social health insurance as a vehicle to finance health systems, and the World Bank has picked that. So there was a lot of economists that was needed to assist the WHO in terms of getting that work done. So I became part of that team, and but getting it rotated into many, many aspects of economics within the bank. So that has been a very extensive career and knowledge. Hence, my world has always been within the money space and international institution by far.
So to a layperson or a person that has or is living with HIV or maybe a brain health related condition, if you were going to say one sentence of how your work is impacting them at an individual level, what would you say? What would you say to them? Let's start with brain health.
With brain health, I'm that guy that look at policies, resources, money, and how best it can be used so that the condition that you have or you're suffering from can be better managed.
But at the same time, you're the person that creates the demand and supply. Right. So basically, if you're doing, if you're the individuals that are involved in creating demands and supply, then you are creating inequalities.
Not really that I'm creating inequalities. I look at it this way. Of course, economics is the study of lack. That's what the Latin word "mica" means. So because I do have a fair appreciation of the demand and the supply, and you understand the scarcity of resources, and those are realities for every government. I mean, the richest government in the world does not have the money to finance all these conditions. Based on that reality that we don't have enough resources, my work is to ensure that with the limited resources, we can get the best value in dealing with this brain health condition. If we have to limit ourselves into just brain health. If it's on HIV, again, it's a question of resources. How best can we use the limited resources so that we can best get the best possible outcome into the condition? And that's mainly on the financing side of things. But I also, like I said, I wear a cap also on the financial engineering side when I'm looking at policies that needs to be implemented so that things get better. So the skills and the tools that I have, it's sort of like you play more of a prophetic role. I could see the end before the beginning, before you implement the policy. I'm this guy that's going to tell you like, hey, government, if you do this, these are the outcomes. But if you take this part, you will get better value.
Yeah.
So that's one work that we do.
So the value in here that we are talking about is who? For the
The
government
patient.
or for the individual? That
For the individual person. Also taking into account what the government is currently facing in terms of resources. Remember what's happening also in our case, you're given a limited budget, like, hey, we have a budget of $1 million USD. We have all these issues at a population health level that needs to be financed.
Yeah.
So you get to be called in. How best can you slice this cake so that each and everyone gets something? Ultimately, we can have improvement in outcomes. So your job then is to then use mathematical tools to advise, like, okay, if you put X number of dollars in this program, this is your yield.
Yeah.
If you put here, how much you're going to get what? And then you engage with policymakers in terms of, how best can we optimize these limited resources to get the outcomes? So I'm that guy who do that. Of course, it's all about that.
So basically, from your job is basically to recommend to government and say, this is the steps that you need to.
I like that.
You need to take.
I like that point that you mentioned.
Because for me, who is not an economist, I'm thinking this is the guy that creates a lot of these inequalities by creating demand and supply, right?
Yeah.
For a caregiver or for a person that is suffering from a condition, be it a brain health condition or HIV, you discover that, for example, in dementia, for example, the disease-modifying therapies are bloody expensive, and a regular person can't afford them. You go out there and say, oh, I'm a health economist. I help government
make decisions
that are best for their people.
Yeah.
And we look at all these, like, for example, I don't even know a single country in Africa that has access to disease-modifying therapies.
Yeah.
I'm just not aware. Not that I've taken interest to do extensive research in it, but I'm not aware. But all I know is that if I had dementia today, I wouldn't be able to afford.
Yeah. So I love that question. And it's something that I always talk about with colleagues, students that I meet, and also just people who've got general interest in terms of economics. We are not people who are engineers of policy, even though we do study the engineering of policies, mathematically so. Because economists are not policymakers. We are not operating with a democratic mandate that comes from a vote. My job is on the advisory perspective. I come to advise, to tell you the best outcomes that you can get. Yeah. So that's why I don't get offended when some of the policy recommendations that I made do not get adopted, because it was never my job in the first place. But I can advise the best way possible, using the best tools or best science that is available to tell the policymakers that this is a particular direction that needs to be taken. Whether it gets taken or not, unfortunately, it's now above my pay grade.
Maybe they should pay you more.
Of course, it's always nice for any economist to see your work get adopted at G20, your work get adopted at IMF level, your work get adopted at United Nations. Kenyan government, for example, when I was there, not even a single policy recommendation that I made was never adopted, which was fantastic. In HIV investment case in South Africa, my models that I work on investment case were fully backed by Parliament, including now Treasury still use some of those templates to finance HIV self-tax technology. When I look back and all of those things, of course, you get proud because you see the value of the scholarship delivering something. But there are instances where a lot of our colleagues get frustrated, where you do the work, you advise, you get a cold shoulder, you have to take it.
But does it get to hurt you as a person if your recommendation is rejected?
Because it takes a lot of time to do these things. Of course, there's always going to be a part of you that feels like, oh man, after everything that I've done, these things are not being implemented. Actually, when I was like youngish in the economic space, it hurts. But I get to grow from it, to understand my role as an economist. Like, but all that I need to do is to produce the best evidence for the policymaker, and the policymaker will implement. Then I'm able to create a distance and not put a lot of emotion on it, and just look at it as a piece of art. Just design this piece of art. Some people will appreciate it, some will not. After all, I'm not money. I cannot be loved by everyone.
And just on the cases, on the medication aspect, on like in the brain health space, we've seen a lot of advancement in the global north, for example. There's a lot of movements in research. A few days ago, there was there was some, I don't know whether it was a summit or a meeting at Davos, Switzerland. We saw the likes of Donald Trump actually going for the World Economic Forum meeting. When you look at all those movements in the global north, in Europe and everywhere else, high-income countries, and you look at movements in Africa, why do you think there isn't much movement in Africa when we also have an aging population and we have increase in the number of cases of mental health and brain health, dementia, and secondary, like you find that there are even more. Brain health is like a secondary disease to different diseases like HIV, for example. Yeah. So why do you think there isn't much movement in the global south?
It's a very loaded question.
Yeah.
I'm going to try to break it into three. Firstly, we need to honestly admit the health systems in Africa were never designed to dealing with brain health conditions. I don't care who says what. That's the reality of it. Because if you look at, for example, a neurologist from the medical school, there's few medical schools in Africa that can offer a specialty in child neurology. So basically, you have medical schools that do not even produce the skills that are required for the Africans to practice as brain health specialists in their own continent. That is why I said, I speak so boldly when I said the health systems were never designed for that. So now there's an aging population, dementia comes, then there's a scramble for resources. How do we respond? One of the problems is that it's almost not going to work for us to start producing neurologists or all these fancy, expensive doctors because it's going to take us longer. There's certain things that we can do now to mitigate. And that's what Africa needs to do, but there's a lack of political will to get things moving at the speed that we should be, considering where the epidemic is going. So that's one aspect of it, like why in the global south you don't see much activities on brain health, partly because the health systems were never designed for that. That's a fair admission. Secondly is on the financing aspect. The financing aspect of health systems in the global south has always been relying on donor funding, not governments. What then tends to happen is that the donors, especially in the context of where the wealth is, there's donor fatigue. It's fair to say that. Donors are no longer generous enough. They want to look more inward in their own countries. They don't want to dispense the finances into global south. So from a financing point of view, there are no resources. That's why you don't see much movement on brain health moving. That's the second aspect. The third aspect is on the policy space. Huge gap. There's a huge policy misnomer in terms of what you need to do with the brain health. Some countries don't even acknowledge dementia as a condition. It's perceived as just an aging problem. You have mental health like depression, anxiety, that are not even acknowledged in some of the global south countries. That is something that government needs to respond to. So from the policy space, there's also no direction. That is why you see Davos, people can talk about brain health, but you look at the continent, none. Things are beginning to change. You started to see government paying attention that, okay, this is something that we need to focus on, but it's going to take a bit of time. I'll also put like the fourth aspect. It's also the philosophy of how do we have to deal with brain health condition using modern science, which is very Western-centric, versus the traditional institution that has been dealing with this problem, the best way they think how. Because, for example, if you're talking about mental health, if you have, let's say, disease like schizophrenia, the moment there's a brain health condition, even though the health system has not been addressing it, but people find their own way to respond to it. So usually people go to church, they go to the traditional doctors, they find whatever medicine they get there to try to deal with this condition. Now that the world talks about these things, like, oh, we need to have brain health as something that we need to do, the other side, they look at things like, no, we've been dealing this thing our own way.
Yeah.
So the conversation needs to be very rich to acknowledge all these deficits that I've already highlighted, and also try to build something based on what already some form of practices that have been existing. Because I've been making example, for example, look at any brain health conditions, including depression and all these issues. The first point where people go in Global South, in Africa, in Asia, is not to go to the health facility. They go to the pastors, they go to the traditional healers for prayer. They don't see the health system as where they're going to get solution. In my view, that's where the demand is. So that's why I always caution a lot of people when it coming to hospital-centric intervention, without shifting that demand to come to the hospital. We're running a huge risk where we can put a lot of resources in the public health systems, but they're not going to be utilized because the population is not there. So while we're trying to beef up the health system so that it can be able to address these services, there's a need deliberately that the governments engage extensively with the churches, with the traditional leaders, so that that demand can be pushed into the facility, because of course modern science have the technical know-how to address this thing. But currently, if you're not doing that shift in demands to come to the facility, we're running a risk where we're going to have health systems, lots of resources not utilized, which is going to be a waste, because I'm as an economist, I don't like seeing inefficiencies. Those things need to attack. Those are the things that I think international, responding to your question, why there's not much movement, or it looks like there's not much movement, it's because of those issues. But a conversation, in my view, needs also a significant shift in how the global north has been engaging the global south. Because in most cases, the agenda is set by the global north, the global south follow. That level of engagement in the 21st century, I don't think it will ever work. They should be moving into a space where the global north look at the global south as a partner in co-creating solutions that can work in the global south, also in the global north. Because in most instances, like also the funding for brain health, 98% of big funding for brain health goes to high-income countries.
True.
98%. So sometimes it's easy to say, oh, no, but there's nothing happening there. But also the funding bodies, they're also perpetuating that inequality. Why all these resources, they're all ballooned into high-income countries, but yet we have a global agenda. So there's a point to reflect about those mechanisms, because through research funding, that's where innovations are. That's where new thinking, new ways of doing things gets to be born. But if there's no money to do those research activities in the global south, it becomes a bit difficult to really get brain health moving in the right direction. What tends to happen then is that everything that is discovered in the global north is sort of like imposed, that it will work into the global south.
But sometimes they don't even impose it. We just copy. So I would want to be fair with that, because I feel, for example, in so many African countries, sub-Saharan countries, when you read some of their policies, they are almost copy and paste, right?
Yeah.
Because how do you copy and paste a policy from Ireland, for example, and paste it in Zambia? Right? And thinking it would work. So part of it is because there's a lack of data, and that lack of data also tells us that there's lack of funding for data collection and studies. And if, for example, if someone is graduating, like undergraduate, for example, I think that's an open door for them to enter the world of research, right? Whereas you're not eligible to apply for funding if you're undergrad in most cases, unless you collaborate with someone who has been funded before, and possibly that person needs to be in the global north, right? So that also creates inequality in terms of funding, and then it forces lazy governments and lazy policymakers to just copy what's happening in the global north.
True.
To the global south.
True. I think your point is valid. Like there's this copy and paste policy that are done, which is super dangerous. I can tell you a horrible story about the danger of this copy and paste and what is also counter to the idea of a healthy aging agenda. I had a lot of work that I've been doing in pension economics. I can tell you now, you go the whole Africa. Do you know that the pension economics in Africa, it is structured based on actuarial science emanating from British system.
Oh, even our curriculums are borrowed from there. So,
but something like a pension. So when you have pension reforms in the UK, like they want to increase their pension eligibility age, African government jump and also want to do the same thing without even noticing that their life expectancy is not the same as the UK. It doesn't make sense that you want to pay pension later. The consequence of that is that a lot of your Africans are going to die before enjoying a piece of pension. And that's like policy because it's cope and pay somewhere. This lazy thinking. That's where I come in from the policy engineering side of things, where we critique and look at things like, okay, these directions are wrong. Secondly, you look at things like also insurance and actuarial science, and some of the nitty-gritties of modeling is pretty much influenced by German thinking. Econometrics still borrow a lot from those. There's nothing wrong about that. But in most cases, when you look at all these models, when you then try to optimize them from the context of the global south, you see different outcomes, which forces everyone to stop this cop and post. Government needs to invest in a young generation of economists. They can come to high-income countries, we get the training. But the training that they get, it should equip them to think innovatively, to apply solutions that are going to be needed into the geographies of where they come from. If we do that, we'll do justice. Currently, again, from the funding of the education, we see government is slashing things down, which is very worrying to me, because the universities that train me, it's a bit disappointing. I went there in many classes. I was the only non-white. And now I look back to some of the universities that trained me in Europe. I don't see anyone who looks like me in the class. Super white. You go disease modeling. You don't see anyone that look like me. Policy engineering. You don't see anyone. Advanced econometric. You don't see anyone. And then that's where the worry then comes like, okay, what is the global south going to do? Because we need to respond. This world is moving at a very high pace. We need significant investment into all those critical areas, because that's where decision science is going to come from. Decisions need to be made from there. And we do need to see diversity and inclusiveness when it comes to those space. Because if we don't, we're running a huge risk where we have going to have this cop and paste phenomenon persisting, which is not going to be an advancement of solution, but to some degree, I think we will be regressing.
Yeah, and just to take you back on pensions, and I know you did some studies on pension and brain health, and what's interesting is some of your work is what was implemented by the Zambian government, my government.
That's good. Kudos. I'm happy to see that.
And it's nice to see that at some point, after a number of contributions to your pension, you can still get a lump sum of like 20% of what you contributed. But for me, I think what still hurts me as a person is when you contribute to a pension scheme, you're basically investing, right? And that pension body is investing that money and making money off your money, right? And if we're going to give you your money, it should be with interest, not just what you contributed, right? So I think and I would want you to talk about it, like what exactly, because when you look at in Africa, for example, a person that retires from work today, there's a trend of seeing their health decline. And part of it could be because they don't have another sustainable way of living a healthy and balanced life, because of many things that you need to do require you to have money. So I would like you to speak to that.
I think with the pension, firstly, thanks to Zambia to listen to me and reform the pension. It's very disappointing in a sense that we have WHO coming up with a policy, healthy aging agenda, governments wanting to adopt to it without looking at the fundamental social determinants of a particular population group. Because we have a situation in Africa now where there's a differences in terms of life expectancy between men and women. Because of that, you also then have also differences in terms of pension eligibility based on the gender. You have then the men who, hypothetically, they're supposed to end the pension later than their women. But the men are dying first than the women, which then create these huge inequalities in terms of pension access, and then the number of years you're going to enjoy benefiting from your pension. What that needs to be fixed, firstly.
Yeah.
Secondly, is also the payout amount. Because when you look at the performance of African pension relative to the population of elderly, they are loaded with cash.
True.
Loaded with cash. So there's a potential to also increase the pension payout.
Yeah.
Innovatively, government have tried to take a certain route, Zambia, to say, okay, now you can claim about 20%. But the payout, they've not increased it. They still kept it what it is. They're just giving you. Yeah. So part of the analysis from the body of work that I've done was to also demonstrate that there was a potential for the payout to be increased. We got to see some traction when it coming to that.
Yeah.
My perspective as to why you see a lot of people also dying in Africa as soon as they start getting their pension is because the payout is low. What I recommended as a start is to make the pension payout inflation indexed. What do I mean? Is that from the government pension, you can't pay a person $1, which is a fixed amount, until they die without understanding the inflation dynamics of the country. So that's why then the purchasing power of the pension gets eroded over time, and no one does nothing about it, which is an unfairness. So as a start, if we can just gazette that into law, that all our pension payout are going to be inflation indexed, it will have a huge implication to the population, where even if you retire, I know my pension is inflation proof, then they can live comfortably.
Yeah.
Unless you arrive into that point, the scenario that you've painted about people getting pensions and die cheaply, it's not going to change. These are some of the work from the economic space that I get to articulate to governments as to what are the changes that are needed to improve population health. Some they listen, some they don't. Those who listen, I celebrate them. Like Zambia now. South Africa, by the way, so they've also reformed their pension based on the analytic work that I did. Kenya, it was embraced. We yet to see what's going to happen. But I mean, those are the small things that happen on the ground that you celebrate as an economist because you've made a difference.
Yeah. Then you also talked about how the insurance scheme works. Part of me tends to think if the biggest risk factor for someone having, for example, Alzheimer's disease is age, then really, in theory, I'm just thinking, I'm not an economist, neither am I a finance person, but in theory, I'm thinking, why can't my pension be my insurance scheme when I'm retired? Or why can't my pension money be my insurance when I'm not working, right? Because when you're not working, for example, if let's say I quit working today, I think, and I don't have anything to do, my brain just goes into a space where I could feel depressed. My brain health wouldn't be at optimal,
Yeah.
So I'm just thinking, like, why don't the systems that we have use the pension as some sort of insurance, even for your health?
It's been used in some countries, but not just for health, for investment purposes.
Yeah.
When government want to roll out infrastructure, some of them, they do tap into the pension with the view that those pensions will be able to accrue investment returns. Those returns will then be passed into the beneficiaries. It's tricky in a sense that we can then personalize and individualize the issue, like, hey, I'm Cyprian, I'm making X number of contribution into the pension. So if I have to take, let's say, a specific loan, people can look at my pension contribution.
Yeah.
It's not really aggressively done in the continent. People are more on what is your life insurance? To some degree, life insurance speaks about, when you die, how much money is your insurance going to pay out?
Yeah.
But those financial products in Africa, they are not as big. South Africa does have a comprehensive finance product portfolio that speaks into some of those sectors. It is possible to do it. The problem in Africa, in my view now, is that the pension coverage is low. The pension are not strong enough to have decent assets that can support that type of situation. For example, if you look at Nigeria, I think Nigeria has about 10-15% of the senior citizens that are already contributing into the pension. Yet we have a huge workforce. Imagine if you deal with all this informal sector, you formalize the economy, everyone works in the formal economy, the pension can be able to derive a lot of resources. Then some of those products can become more easier to optimize in the market. But if the economy still by far remain largely informal, it becomes a bit tricky to do that. But it's something that's worth doing. I mean, it's like sometimes you think about countries that are having like a lot of unemployment. Why don't you make your city become a 24-hour economy? Imagine what it will do to unemployment.
I've been wondering why Zambia isn't a 24-hour economy.
Just become a 24-hour economy.
The only time it's a 24-hour economy is over the weekends, because then people can binge drink from...
Because we are drinking.
But I've always wondered why we have high levels of unemployment.
But we're not tapping into that.
We have a very youthful population. If we could tap into that, our economies would grow. Yeah. But because of whatsoever reason... we actually have more young people that don't have what to do.
They sit idly.
So it's...
That's where then as economists you come and you advise, like, but why? Because, I mean, once upon a time, New York had horrible levels of unemployment. But look at the spillover effect that happened when that city was just transformed to become a 24-hour economy. The levels of employment that just went super, super low. Yeah. So those are solutions that are on the ground that the continent needs to look aggressively into them. And I don't want to talk about the minerals that are there in Africa. If you are beneficiating them, the spillover effect in terms of just lifting people outside the poverty are huge. So in a way, when you then start looking things more critically, the unemployment in Africa is by design.
That's also interesting. Perspective. And
it's all by design, like I said, because think about this thing, Africa is the richest real estate on the planet Earth. It's the only region in the world that can close its border and it can still survive by relying just only on itself. All the other regions of the world cannot do that. Yet Africa is the only piece of the world that is like suffering from grinding poverty. That's like witchcraft on steroids. Doesn't make sense to anybody. It cannot be. Yeah. It is the only continent that's supposed to be in the forefront for everything. Because to be quite honest, it does not need anyone. But then it's this thinking process that needs to change. It's the young generation. I hear a lot of people talking about the age dividend that Africa have because of the youthful population. Of course, on principle, because it has a youthful population, the fertility rate is increasing. If you don't educate these youngsters in Africa, you're not going to get that youthful dividend on the continent, because you're going to have now demoralized people who are just going around hopeless. You already see now a lot of Africans are trying to cross the Mediterranean Sea, come to Europe for greener pastures because governments are doing nothing, which should not be the case. Because if things were more inwardly done, there's so much economic activities on the ground, we trying to modernize our rural areas and make them places that are worth living on. There won't be the need for Africans wanting to go to other parts of the world looking for greener pastures. Everyone can work locally. But that's the thinking that is needed from the policymakers, from the population itself, and for me and you who have access to be in high-income countries and be given a privilege to study in these exclusive universities. That once we get in a position of influence, we need to speak the truth the way it is to make the difference. Like I said, I'm one person who celebrates small victory. To see Zambia listening, like, okay, they're going to do something with the pension. To me, it's enough. But I understand that we need more because, like I said, it's no longer going to be acceptable that for the wealth to continue to move in a way where countries accumulate resources, whether legally or illegally, at the expense of the continent. Once then you started to see radicalism begin to ensue, we want to make all sorts of excuses why these things are happening. Because the fundamental economic principle in any textbook tells you, once there's inequality, there's poverty, you're going to have violence, you're going to have all the social ills that we don't want. But once you understand the basics, just give people food, just give people dignity, all of those things disappear. So the biggest problem of solving the social ills is not to militarize the police. It's just come back to economics. Yes, you don't need to militarize. I mean, for example, when I'm in the Netherlands or even here in Ireland, I mean, you can go 1:30. I don't have a problem that someone's going to come and mug
You
and
know?
take my phone. Of course, if you're in a country where there's inequalities, those things are much prevalent. Because fundamentally, the people here, they have breakfast, they have lunch. They might not have the wealth of driving a fancy car.
And they choose not to eat.
And they choose not to eat, exactly.
You can choose not to eat.
Yeah, you can choose not to eat.
Yeah.
But think about those things. It's because it's just come back to a small economic principle. The dignity is there. People are given the resources. Food is there. Everything else can then drive.
Yeah.
And that's why they don't have the problems that are associated with inequalities. To me, if there's one thing that needs to be decisively attended, it's just to deal with the social conditions of African in the continent. A lot of things can be improved, including brain health, without having to medicalize and create all sorts of resources in the systems, just by dealing with poverty, which still by far remain a huge risk factor. And the sad thing again, if you look at from the mainstream literature, even in Lancet, poverty was not mentioned as a risk factor for dementia. I had to fight for that and bring it to the scientific world to say these things that we're talking about do not have global applicability. And that's why I challenge me and you who have access to come to these big institutions that are so influential to set the agenda, what needs to happen.
Yeah.
Because if it doesn't speak to us, we have to raise the voice to say, no.
Yeah.
This doesn't speak with the people there. We know decisions are not going to be taken if you've not acknowledged this as a risk factor. So that's where, again, as an economist, you become now this beam that shines the light on behalf of the people. The little we do, the better. Exactly. Yeah.
I think the work that you've done on the risk factors is so remarkable, and it was nice to see it published. And I think one of the risk factors we don't actually talk about is, I know we talk about it indirectly, but right now we're like living in very uncertain times.
Yeah.
You know, where a president can just decide or take over this country and it's going to be mine, and it puts the world in a space where now people have to prepare for war.
Yeah.
For example, there's been a war for over 4 years now, Ukraine and Russia. America wants to take over Greenland and Venezuela. There have been a number of coups that have happened in the past, Sudan, Libya, and Congo. Congo has been in war for
forever.
Probably even before I was born, Congo was still in war. Okay. Yeah, so it's interesting to just see how there's been so much happening, and countries are investing heavily in military for safety reasons. And for example, the budget of the United States, right? A bigger percentage of that budget is military.
Yeah.
Right? And there's almost just a small, sizable enough budget to comfort people and say, this is what you're going to put into healthcare, right? Then you look at all those, and now my question to you is, in these uncertain times where there's a crisis, the prevalence of dementia is going to triple by 2050, countries are investing not in healthcare, but they're investing huge amounts in trying to protect themselves. My question is, be it in the global south or global north, how do you think that is going to impact us in the future?
Shoo. Yeah, you've done your research well. It's a loaded question, but just to answer it simply,
because I think
military spending
in the next 5
makes
years,
a mockery of brain health. This arms race that we see, and the wars that intentionally beginning to ensue because people have so much military vessels they need to unleash to offload the stock, because some of the wars I think that were started are just based on stupidity. And those are things that everyone, if you track just that variable military spending, to some degree it will tell you about the mental health havoc it's going to create to the world. Unfortunately, governments look at military spending completely differently. It's perceived as a good investment to protect the sovereignty of the state. But that's not always the case. Because the one who has the weapons at some point start unleashing those weapons to other victims. And the victims has always been, for a larger extent, the global South countries. My view is that with more military spending, education budgets are going to be cut, health budgets are going to be cut. Brain health is already suffering. US have just pulled out of WHO. We had a discussion with some of the people working there to say they are barely coping. If it happens at a WHO level, think about a local village.
Yeah.
You don't even have to talk about disease modifiable therapy. It's like a dream that's not going to be realized soon. All of these budget cuts are going to have a negative implications to the brain health agenda, definitely. So sometimes, when I'm sitting alone looking at the numbers, I just wonder if human beings are the most advanced species on the planet. Because I just struggle with the concept that the things that's supposed to benefit us all are just put secondary.
Yeah.
And the things that we should be working to not even have to spend a lot of resource on it because we can reason with one another. We don't need to spend aggressively on military because we can still have utilize diplomacy. We had a World Trade Organization, which was supposed to be a vehicle to sort out trade disputes. None of those things are being effected to deal with some trade dynamics. Yeah. Instead, we see force is being used to loot, to pillage, to steal, to take resources. And the consequence of that, it polarizes society, it creates inequalities, it creates the violence, and that becomes the systems of governments that runs our life. And I don't think human beings give themselves enough time to sit back and reflect, to say, if being human, because we call ourselves human beings, I think there's something we can be better. We can be other beings that are better than human beings, because currently being a human being is just associated with madness, things that we can easily solve, but we've not given ourselves enough time. And those are the things that I'm seeing just when looking at the social breakdowns that are going to come from just underspending on brain health. It will have definitely huge implications. Already now, suicide cases are rising. Africa is number one because the resources are not there. Secondly, also because there wars that have been going for a long time. Libya is still in flames after the death of Gaddafi. DRC is still undergoing a lot of instability. You see Mozambique with the discovery of a bit of oil. There's been a lot of instability. South Africa has to put military not so long ago to stabilize the situation. So those things are very troubling to me. And like I said, human beings, sometimes it's difficult to understand the human behavior. Yeah. It tells you how complex we are maybe as a species.
Yeah, I think it would be nice to just know the impacts of war on brain health.
To be honest with you, it's not even like rocket science. There's a lot of studies that have done on children who are on concentrated camp, who are victims of war. You can look at the brain volume versus those who are not experiencing that. Got huge. It facilitates pathological aging. And with more and more of those things happening, we're going to shrink our brains. It takes away all the optimum creativity that this generation will have had. I mean, also here in Ireland, after the famine, that trauma created a lot into the society, where you see even things like a relationship, people are less likely to engage in meaningful relationship because of the traumas of what happened from the past. All of those things are going to be part of us. And like I said, we have not even studied the brain correctly to understand the legacy effect of the war to subsequent generation. But those things are all negative. All those numbers are going to be on the negative side. And substance abuse that comes with war, including the soldiers in the US that were participating in all Afghanistan's war and all of that, when they came back home, a lot of them were never well. So the consequence of military spending, of course, if you look at it from the context of brain health, it's fair to say that it's not good. And I would want international institutions to never give up on the idea of wanting to use the current instrument and tools to settle disputes between countries. Because once we lose that, we are opening chaos, in my view. Of course, I'm not saying that those institutions are perfect. They're not. They need to be strengthened. But I'm against the idea that we need to do away with them. Yeah. Just like now we're trying to destroy WHO. We defund it. We're doing all sorts of things. It will have a huge implication. Like I said, World Trade Organization needs to come to the party and do a better job in regulating trade fairly. Yeah. United Nations Security Council needs to be reformed and reflect the realities of the world, like the top 5 countries who are having veto powers. The world has changed completely. Yeah. So all of those things are needed rather than wanting to move away from an international order and the institute we've created. We should find way to strengthen them because I do believe that they will have a role in creating a better civilized world. And we need to tax more aggressively, especially the rich. To me, it makes no sense that the top 1% almost own 82% of the global wealth alone. And there's just no way we're going to have a civilized world if we have that. The tax system still need to be revisited to create a more equitable, fair society. Because the more this inequality, the haves and the have not, because the middle class is shrinking, it becomes smaller and smaller, including the US, the more we're going to have these barbaric behavior persisting.
Because what's so interesting is more countries tend to tax its own people more than they tax
the rich.
Because, for example, you have countries where, for example, mining is big, for example, in the likes of Zambia. You find that most of the people that come as investors, they even get tax breaks. Then there is me who earns 10,000 kwacha and they tax me 37% in pay as you earn. So basically, I'm just living hand to mouth. Because then I can't save, I can't live an optimal life. Well, we are lucky in Africa that we're able to do certain things because of the communities that we have. For you to be able to do certain activities, hang out, socialize, all those require money. We are trying to prevent all these diseases. And you look at the risk factors and say, how do I prevent them? You're looking at how much money you're going to spend, right? So if we could have systems that actually support people, or even at the core of it, reduce taxes for the local people, at the same time you support the investors, right? Or because you find that most of people that invest in the economies, sometimes they even get people from different countries. So the local people are not even benefiting in that particular trade. So you're depriving them of jobs. So meaning at some point you'd have to tax those people higher so that they should either hire your local people or a particular percentage of that money helps to improve the economic status of that particular demographic.
And all those things that you've mentioned, they're all correct. There's been plenty of examples in economic literature to show how to just create better human dignity with the resources that we have. It just comes back to dignity. Because to be honest with you, Grant, in my own view, just living in different parts of the world, it's a few people who want to become aggressive billionaires. Most of the people in most societies just want enough for them and their families to get proper healthcare, good education, and just be happy. You don't see people want to become aggressive billionaires and start doing all sorts of crazy things. But at the fundamental core of every human being's existence is just dignity. It's just the dignity of them feeling like they are treated with respect, the dignity of being a man, feed your own family, take care of them, be a human that wishes to see progress. That's the basic existence in most societies. Is about that. What tends to happen is that society gets robbed because certain people look at it, these things like, okay, how do we concentrate resources in few hands and create scarcity? And through that, we can then be able to exercise some level of control into society. And then we started to scramble for resources, the resources that are already existing for all of us. If they are distributed equitably, there won't be any hunger in the world. There's enough food in the world for all of us to have a plate of food before we go to bed.
So when you look at all the disparities that we currently have in the world, because for me, the way I see it is, whether you're in the global south or global north, a person is a person, and we get to be afflicted by almost the same disparities.
True.
Maybe the differences are in the degree of the shocks.
The intensity of the shocks,
So if you are going to advise me, because I'm more interested in young people, because they are the future. So if you're going to advise me as a young person, on how I can be ready to grow, like to age well. Like what would be like your advice, right? So
I would say let's go back to the basics. The food that we eat is poisonous. If you have your own land, have your own food that you can grow yourself, you eat from the land, there will be a good progress rather than wanting to rely on the poisonous chunk that we see. And the industry is becoming stronger and stronger. I don't want to name them. That's going to have a huge implication into your health.
Yeah.
If you want to look at the economy and the revolution that's going to come with AI, it's very scary to me because a lot of jobs are going to be displaced. I mean, I was seeing in the US already cars drive themselves. If you're an Uber driver, chances of you having to have that job, if you're a truck driver, if you're a taxi driver, once that industrial scale of just AI gets optimized correctly, it's very scary in terms of what it will do to the employment of the sectors that are currently existing, which some of them might not be able to survive in the future. So as a young person, I will look at some of those dynamics and trends and then say, how do I have to skill myself to the economy that is coming in? Those who are mathematically gifted, I think they have an advantage because mathematics and robotics are going to be the main sector. So it's going to be good for people to start planning for those sectors because I think they're going to play a more decisive role in how the economies are going to be run into the future. So those are the things that I will advise young people to look and seize those opportunities because it's an equalizer. High-income countries, they're also looking into those sectors. In terms of just lifestyle, the lifestyle of young people in Africa needs to change because they are incentivized about Western lifestyle as if that's a gold standard. I think there's a significant shift that is needed on that. It's not a gold standard that they need to look into. The consumption of alcohol, drugs and all of that have been normalized to some degree. The vapes and all of those things, they play a huge role in really reducing your qualis. And the young people need to be told about these things. And then I will say it has to come back to the family unit. I'm a strong believer that there's nothing that you can do as a human being if the families are broken. You need to fix it at a household unit. The young people feel they have a strong backing in their family. It's difficult for them to be hypnotized or incentivized to do things that is contrary to their family values. Those are the things that are like the fundamental cause that needs to be relooked correctly. And the question of fertility also is something that is a huge problem that I see, and it's not been discussed correctly. Fertility is declining in many, many parts of society. The consequence of that is that you're going to have an aging population and there's no generation to take over. That's the reality. And I think the fundamental principles of life, we want to live life and create legacy, knowing very well that there's a certain generation that will take over and relive our legacies. If you're a young person, you need to start thinking more carefully about those things. What is the legacy that you're inheriting from your parents? And what is the legacy that you want to leave behind for your own children? And can you work in making a better legacy? So those are the things that I will try to conscientize them about. And I think fundamentally it's all about also things that we're like taking it for granted. We've been speaking about it, spirituality and the economy, spirituality and brain health, spirituality and human progress. It's been so suppressed that even in Western institutions, nobody discussed these things. But these are the issues that fundamentally as a young person, you will be confronted with. Because everything that we see here happening now, it has so much spiritual connection. And that's why I argued quite strongly when Lancet says, we have the social determinants of health. And they mention all of them. One of the social determinants of health is spirituality. And no one talks about them. Because why am I saying this? We can take all these fancy modern infrastructure that is here. If we can take it and put it to Somalia, the same infrastructure that is here, is Somalia going to be Netherlands or Ireland? No. What is the difference? Because Somalia has a different spirit than the spirit that is here. We've not taken thorough, careful analysis to understand what does spirituality do to the human race.
So what do you mean when you say spirituality?
Religion is a central component of human beings. And their spirituality, where I want to look at it from the religious point of view, the things that we are doing, has huge determinant effect into how they live as human beings. You as an African, when things was done according to your traditional beliefs, and all the customs that you do are spiritual vessels. You are not losing that as a Zambian person because it determines where you go.
So when you say spirituality, you're talking about belief systems.
The belief systems. Belief systems have a huge implication into the determinants of health.
Okay.
That has not been studied now. It's always been pushed aside. For example, if you go to Kenya or Nigeria, the Muslim interactions and some of the violence that we see there, it's a spiritual war. What it do to the health of the population? What is that we as young people who are thinking now innovatively about the future that we need to create? We need to reflect about some of these dynamics because they play an important life in shaping who we are and where we're going as a human being. That's why I'm saying sometimes we're becoming very scared to discuss spirituality and health. But it is a determinant, even though we don't want to announce it like this has a huge implication. There are studies that have been done also in Europe to look at certain religious group and how long do they live and what are the factors behind the religious practices that are associated with that group that make them live longer. That science is there. And you can see that spirituality has a huge implication into that. You can look at certain religions who are not eating certain food and they're practicing certain rituals. They are becoming less violent people compared to people who are eating certain food and drinking certain drinks.
Interesting.
So all of those, I can tell you, I don't want to promote a certain religion in the podcast, but I can tell you, if you look at Rastafarians, the food that they eat, the diet, when I see riot in the streets of Johannesburg, I don't see Rastafarians being engaged in violence. But certain people who eat a certain diet and drinking a certain type of food, they can move from 0 to 100 instantly. They're like violent beasts. So because of the things that they do, the practices that structures this type of people bring certain level of behavioral differences.
It's interesting that you talk about spirituality and earlier on talked about the concepts of family and community, because I think that's one of the key issues that always come about when you are ill, when you're sick. You always need a community.
When you're sick, the people that rally behind you is your bloodline, and those are the people.
And friends.
In Zulu, they said those are the people that, but back Lula, those are the people that brings life to you. It's not about the fancy hospital that is built on the corner there. It's how the African systems have been structured. You see that implication of it to this very day. That's why I said, to me, it's easy for me to lose people that I meet on the street because they don't know you. But there's something that you need to fundamentally protect. Don't lose your family because there are people who are the core you. That needs to be protected. It does not need to be destroyed because it's got huge implication into you as a determinant of health. That aspect, I'm saying, from the modern day literature is not existing. But based on the experiences that you see, you can see like this thing has a huge implication.
Because there's certain things that are not studied, and I think we'll come to it when the time comes. Arts and science. There isn't enough data that we could use. Like if a patient came to my clinic, I wouldn't prescribe and say, because of maybe your diagnosis that you have schizophrenia or you have dementia, I'm not going to prescribe it and say, I think your family needs to do this, because I can just say it roughly or encourage the family to support the person, but I won't have scientific backing for it, right? So there are certain things, and this is the part where I always think like community, creativity, expression for me, which is like arts, is like very fundamental, and also sometimes can be actually very impactful than all the drugs and the treatments that I can have at a clinic or hospital. So some things we may not be able to measure them now, but we can't say they are not important.
Because it's that interconnectedness
Yeah.
that it brings, and it makes a huge difference. I don't think human beings were designed to be vertical human beings where it's me, I can do it on my own.
Yeah.
We do need one another because it's only, like the Zulu saying, I am because you are. So we were destined to coexist, and there's no need for one to think he's better than the other. Which are the value system that I see gets eroded, especially in the modern day 21st century capitalism. You see Africans moving into the village as soon as they come from the wealthy suburb, the world that is big. I hardly ever know my neighbor. We meet on my driveway when I'm going to work. So you live this isolated life, and you're losing so much human connection, which so far I want to pin it down to just your basic family unit. It's something that we need to keep intact as a young person who wants to understand the complications of the modern day wealth. You don't need to lose that because it's going to be your determinant for health.
Yeah.
Arts fit into that space. The engagement that we have, the practices that we borrowed from, and the connections that we have with some form of art, because I'm very open-minded about the art space, because not all forms of art are progressive. The good ones need to be implemented, needs to be studied, and we must know them, we must list them, because those ones that are positively influencing our life have to be kept. Like, for example, you go to the village in Zambia, every time there's functions, there's singing and dancing, because there was a particular understanding that certain songs, certain dance were performed for specific meaning.
Yeah.
There was a conscious decision. If you go to the mountains of KwaZulu-Natal, when they welcome you, there's a certain dance that they need to do for you, because the ancient tradition and understanding was the proper acknowledgement as to what it does to your spirit as a person who's been welcomed. Just like haka in New Zealand, when they perform that haka thing, it's the art dance, but it's designed to trigger fear to you as a person who's been an opponent against them. So they perform the haka to instill fear on you, so that they can then win over you. You understand? So art, that's why I said the whole space about art needs to be understood correctly. So that's why when you play against them, some best coaches tells you like, oh no, when you play them, as soon as the whistle starts, you need to take whatever they've got from the haka in order for you to win the game. So you understand? So art has duplicity. It's a binary variable that can be good or bad.
So considering that part of it, I would say there are inequalities. Or about equity. When you look at the inequalities that are in the arts, I know you have over 50 peer-reviewed papers, but we haven't seen arts being funded by the scientific world, right? Because I can't go and say, oh, I have this dance that I tried. For example, in my case, I would say maybe with 50 patients, and I saw them, these individuals feel lightened up, happy. And most likely, though I didn't measure, their stress levels significantly dropped. Right? Why can't I go, for example, I go to a scientific body and say, I've seen this happening. Can you measure it? Right? Because when you look at, they're not going to fund me because it's the type of science, a different type of science that they do fund. So when you look at how the funding system is structured, artists can't come on board and participate because then you'd have to convert an artist into a scientist, which is not very fair. Because if you convert an artist to be a scientist, then they can't be an artist. You can't call them an artist, right? So why then do we not see a lot of investment in arts? If arts are able to bring people together and improve
their well-being,
why are institutions and organizations, funding bodies, not funding that space?
Let me break it into two. It's not to say it's not been funded. There are specific programs that I see now emerging, like, for example, Africa Fingers model. One of the finger as part of the finger model is the art-based intervention, where we're trying to estimate for the first time the impact that these art intervention are doing to the brains of the population. In a scientific world, there's a beginning of change of heart to look into that space. My issue here is that the art practitioners needs to be empowered to understand how the scientific world operates. Certain assumptions cannot hold in the scientific discipline. I'm talking as an economist. If I have to make a decision, do I have to put X number of dollars into an art-based intervention? What's important is that I need to treat this intervention like any other clinical trial. Drugs come in, we test, we see how it works, we measure the impact. And then once we're satisfied that it does have a quality improvement, then it gets adopted. And then you can put resources on it. That work has not been done on art. Then it becomes difficult to justify the spending patterns into art-based intervention. That's why I'm saying for now, for the first time, at least with the fingers model, we can be able to see and estimate the impact of those interventions so that from the investment case point of view, they're defendable. Because remember, as an economist, I work with numbers. I have to see like, okay, if I'm recommending that X number of dollars need to go to art-based, I should be able to defend the quality gain that's going to be associated with it. And if there's no evidence, unfortunately so far, I'm like, it looks like the spaces still need to evolve. From the art perspective, they need to understand how things are done, how decisions are done before monies can be put into those programs. And then there's so many things that needs to be teased out. That biological pathway of art needs to be very clear and measurable. Like, for example, if I'm performing a specific dance, of course, the well-being and the happiness gets higher and people's stress level go low. The most important thing is that what is that the art intervention does? Is it because of the coming together of other people that's becoming more impactful? Or is it because of the act of dance itself that becomes more impactful? And what are the pathways and channels that brings that change into my brain health? That space needs to be investigated. And I want to see the mainstream scientists as well as artists coming together without big egos, with respect, because I think that work can be done easily without having to be in each other's neck. That would be my plea. Do I believe that some arts can be used? Yes, I do believe. Because like I was saying, you see it in many, many societies, art is practiced daily. In gatherings, specific function, the songs and dance that are performed to make people happy. I don't have doubt that we can be able to find a biological pathway to explain it. From the investment point of view, it needs to be treated like any other trial. We need to study it like any drug. Sometimes they fail, sometimes they don't. Those who fail, we go back, we optimize. Art needs to be treated like death. And then ultimately, better decision and more informed perspective can emanate from those trials. Then investment will be done. And I don't have any doubt that's the route that we need to take, rather than wanting to have a certain bravado of looking down to other people. I don't think that would be helpful. Respect is needed. And the two needs just to come and co-create something more meaningful without having to be territorial about it. Because that's my personal view. I feel certain people are more territorial about it. They feel, this is our own thing. We don't want other people to come and tell us how things are done. And the other faction also does the same. And then things get lost in translation in between. And I think those silos need to be broken down. And then we can be able to see better evidence emanating in terms of what is the role of art in terms of brain health. Because, for example, some people are painting things and putting on the wall like, this is good for brain health. I don't know how good it is. But if there's a biological pathway, scientifically, robustly estimated, I will get convinced. But for now, it's mainly hearsay and mostly individuals' reflection in how a certain piece of art that is hanging on the wall make them feel. It's good. But like I said, if I don't have then now the tangible evidence, it becomes difficult to make decision on it. But I believe that in future, the two needs to come together, and then something more progressive can be generated from it.
Maybe my thoughts has always been it would be unfair to turn an artist into a scientist, because then they're no longer an artist.
I have you don't have to turn them. You just have to let them be.
So in that particular case, then it should be the scientific community that wants to measure the actual impact of a particular intervention.
True.
To say, can I be part of your project? I would just like to measure, right?
Yeah.
Other than saying, how do we know, right? Because it's easy to say, but how do you measure the arts? It's easy to say that, right? But I think the direction I would want to see is scientists getting to a place where they are curious and say, oh, that looks interesting. Like, Grant, what you did there is interesting. I think maybe we can create this model, and do measurements.
Yeah.
I think that's a curiosity I would like to see, because I feel the conversation right now is always arts versus science.
Yeah, true. Like I said, like I made that admission to say that approach is not progressive because the other side doesn't want to listen to the other side simply because people are territorial.
Yeah.
From economics point of view, I don't need to be territorial. I'm more on decision analytics, decision science. Hey, does this thing make sense? So then when I sit and I look at people conversing about art, what is important to me as an economist is that if I have to back a certain dollar on this intervention, I don't need to trade with my career. I need to know that it's scientifically robust.
Yeah.
So that's why I'm going to look at it from a position of how do I appraise this, that it works? So from the curiosity point of view, then the question is like, okay, I think what you're doing here is really powerful. And I believe it does have an impact. But you as a scientist, can you please work together to pin this evidence so that investment can be done? Of course, scientists, because they are curious people, they're always going to shoot ideas. Sometimes people might not be comfortable about questioning that the scientists are imposing on this space. But my view is that we don't need to be emotional about it. All we need to do, because it's only the questioning that will give more answers. And through more answers, we'll discover that we don't know much about it and we can research better. Because if the questions are suppressed, the danger is that the space is not going to move forward. And that is the approach that I always want to see the two worlds agreeing to what's like, okay, if scientists want to come and do measurement, as the art, there's nothing, you're not losing anything when the evidence maybe point into a certain direction. It's not to say what you're doing is meaningless. Like someone who's trying to discover a specific drug. Sometimes you said, I've got this molecule. It goes on clinical trial. We find like, no, it's not. Then you go back, you do something like, hey, I found this like disease modifiable therapies. So art needs to go through those processes too. And ultimately, I do believe that there's something that's going to emerge in that space without having to be territorial about it. So that will be my plea. That's why I'm saying to the question, artist does not need to change art. They just need to be art. We love them for that. The scientist with the curious mind does not need to become an artist. Must come with all the interesting question. And then devices and tools can be applied. And then let's see what the science tells us. Then us on decision analytics, like, okay, this is what the science, this is what we're doing. This is the quality gains. Yes, we are investing. We are all happy. We're moving together. That's how it should be.
I think that's the way it should be. And as we wrap up, I have one question for you.
Okay.
If you had all the power in the world to redesign global health economics, like if you had to redesign the health system, what's the one thing you would change first?
That's a very tough question. But I will want to see a health system that does not treat human beings. It's like a conveyor belt. Come in, come out, come in, come out. And the quality of care gets to be lost. I will want us to imagine a health system that truly, truly designed to buy us health. Rather than wanting to create a healthcare system, which is what is currently happening. We've created a health system, but we have not really, really doing a good job to create things that gives health. We've got a healthcare system that is very good in treating symptoms, but not reversing disease. So although I it's sort of like imaginary. These are the things that I will want to create and understand it much better. Can we have a health system that truly buys health? Can we have a health system that truly reverses disease, not manage symptoms? Can we have a health system that doesn't treat people like a conveyor belt, come in, come out? There's some utility because you visit us, then you're gone, then we have something. because that's how the modern health systems are run. They're very hospital-centric, they're very expensive, they're doing horribly in reversing diseases. US is a classical example.
Yeah.
So that's something that I will try to reimagine. And global health economics needs to contend with this type of questions, where the mathematics of qualis, beautiful as it is, does it not have some level of bias? How do we measure well-being? What metrics are we using well-being with? So all of those things are sort of like hypothetical, because it forces us to look beyond what is currently existing. I do believe that going into the future, a hospital-centric model of healthcare might not be what we need, because best healthcare that we can offer is in the household, not in the hospital. But if it's in the household, what does that need to happen at the household level so that the things that are in the house are good enough for us to get health, rather than wanting to run to a system that gives us pills that might just be managing symptoms, not giving us health. That's the future of a global health system that I contend with to this day. And it's a dream that I think, as human beings evolve, strongly believe that those are questions that we're going to be confronted with. Just to expand on this, and I've seen things like with depression, where you can have a ketamine drug in a private healthcare, it's distributed, people feel the depression level relieved for a day or two. Day 3, they're back at square one. Someone is making $1 on ketamine. You have then a situation where I've seen people who are really, really depressed because of the poverty, and you just give them food. They're fine.
And work.
And human dignity. So then the concept of a global economist that knows health systems with the view of making a difference, that paradigm might need to shift, because there's so much that can be done, not in the system, but at the household level, that can make meaningful difference. Look at also how we structure the investment case. We're looking at the resources that needs to go to the hospital. And no one posed a bit to say, are we truly right to say, if we beef up the health system with so much resources, we'll do good to deal with depression, anxiety, and all of that in Africa? Instead of taking all these resources, when we plug them into the health systems and make it super expensive, what if we just pause a bit and said each and every hungry tummy will feed you? What impact will it do to the depression, to the hopelessness, to the stress? Maybe, just maybe, we might discover that we don't need a complicated, expensive health systems with so much commodities and fancy people speaking expensive English. But we may need that. It's just human dignity that all we should be striving for, to reverse the poverty, to respect each other, to love each other more, to be there for our families, to be truly, truly human in a sense of our interconnectedness with our people. Maybe that's the best recipe we can give, rather than all wanting to claim to be so complicated in the things that we do on behalf of wanting to buy health. These are questions that I contend with in my book that I'm writing. How do we buy health? And what is the best vehicle to do that? Once the book is ready, you'll be the first in your podcast to know. But yeah, those are the things that are in my mind, I think. Those are the things that needs to change in our quest to truly buy health. Things like that, to me, I think makes more sense than the race of building a fancy hospital. We chop a red ribbon, we celebrate, we say, voila, we have it. Because the evidence that I see now in my own little corner is that aggressive health spending does not buy health, unfortunately. That evidence is becoming stronger and stronger. I challenge a lot of people to go look at the US. The level of spending that went there is ridiculous. And the performance of the US health systems, despite the fact that it has so much resources, is poor. There are countries that are spending a fraction of what the US has. It's able to outpace and outperform the US health systems with limited resources. That is why I'm in a position to say, are we really, really truthful when we say ballooning this healthcare system model is the only vehicle that's going to buy us health? Maybe we are not right. And then what are the alternatives? The alternatives is maybe we need to go back to the household level. What do people eat? Do they love one another? Do they care and support one another? Do they have the good nutrition? Do they protect themselves from alcohol and substance abuse? Do they live collegial with one another? What are the implications of that with limited resources that is needed just to achieve that in terms of outcomes and the life expectancy? So those are the powerful questions that are potentially going to change health economics and everything that we've conceptualized, the models we've created. I think, to me, we're living in interesting times, and those are the things that we need to be studying so that ultimately we can be able to truly and fairly talk about the power of money into the health system. Because currently that relationship is becoming more clear. I'm convinced that an aggressive health spending system is not the best way of buying life expectancy. We can do better. So we need alternative models. So, thank you for inviting me. It's been nice, man. Yeah, it's been nice. It's been nice.
If you enjoyed watching this episode, don't forget to comment, like, and subscribe. We'll catch you next time.